Welcome to Spectrum Perspectives, real talk with parents, professionals, and autism advocates. With your host, Cindy Gellermini.
Hi, everybody. This is Cindy with another episode of Spectrum Perspectives. And today I have Dana Walker, who is here to join us. And she's a mom, and she kind of works in the field of special education. And we're going to talk to her about her story and her son's story. Hi, Dana. Welcome to the show.
Hi, thanks for having me.
So where are you located? You're in Texas, right?
Yes, I'm in a suburb of Houston. I'm in Sugar Land, Texas.
Oh, okay. Very nice. How's your weather over there today? I'm dressed in a sweater and it's cold. And
The kids are swimming next door. It's hot.
Oh, I'm so jealous. So today we're going to talk about your son. What is your son's name?
My son's name is Brady, and he's 16 years old.
16, but you have two sons, but we're going to specifically, right?
I do. Grayson is 11 years old, and Brady is 16.
Okay, so Brady is your firstborn, right?
He is.
Okay, so let's go back to the beginning. I start every interview the same way. We go all the way back to your pregnancy. So tell me about your pregnancy. Were there any red flags, any kind of issues?
Long story short, I was unable to become pregnant. So my husband and I started the in-vitro fertilization process and had to do a special procedure called IGSI. I think that's how you say it. But anyway, we became pregnant, and it was a very difficult pregnancy. I went into early labor twice. My son was born in March. I went into labor in January early, and they stopped it using something called breathine, but I was hospitalized for a few days. And then I went into early labor again in February, but he was born in March. And as soon as he came out, the doctors came to tell me that he had something called Stridor, which another word for that is laryngomalacia. It's where the tissues in your vocal folds in your esophagus are flimsy, and they kind of fold and flap. So when you're breathing in, it causes like a whistling type noise. And at one point, the nurses said, he's so loud, the Stridor noise is so loud, could he stay in here with you? It's waking the other babies up. So he had difficulty feeding from the get-go. We immediately found an ENT doctor, and he had to have surgery at 2 months old. So they just kind of trimmed the tissue in his throat so that he could breathe better, so that he could eat better. But we still had to poke holes into his bottles, larger holes, so that he didn't have to suck as hard, because he had to work twice as hard in order to get the fluids down. And we did feeding therapy for about a year and a half to help us with all of those issues. So he had a rough start from pregnancy up to the 2-3 month mark. It was pretty tough for us. We were very exhausted because he didn't want to sleep, because he was just so hungry, but he was also so tired.
Poor baby. Who does feeding therapy for them at that age?
I went to a speech therapist here in Houston that specialized in feeding therapy, and we just worked on stimulating the mouth, desensitizing everything. We worked on different textures of food. So we started with the liquids, and then we went to a little bit more of a textured food, and then we just continued to increase it. But I can remember when he was in daycare, taking like a burrito, pouring milk in it and blending it up to where it was just nothing but pure liquid. But that's what he ate, because he was unable to take the quantities of food like a normal child would.
At what age was that?
We did this probably for about a year.
Okay, because kids are usually just on the bottle for the first year. That's why I'm like, wait a minute, he's eating burritos?
No, he was in daycare. So the daycare baby room went up to like the age of 2. So something like that. Yeah. But I can remember having to blend the food. Then I had to weigh the food. It was just, it was a lot of work.
Yeah. Yeah. And here you are, a first-time mom, having to go through all this. You must have been very nervous and scared. I would have been.
I constantly had my mother-in-law and my mom move in with me, just so that I could sleep and get breaks and things like that.
And the
It was
noise too. I'm thinking about how the nurses complained about the noise in the nursery. I mean, you know, you're already exhausted as a mom of a newborn, and then if he's sleeping and making that noise, I would have
and
been
not
nervous. Is
gaining
he
the
breathing
weight.
okay? Yeah.
Yeah. And then he wasn't gaining weight. So then we were referred to a GI specialist. And it was a lot of visits at Texas Children's Hospital, a lot.
Mm. Yeah, that's a lot for you to go through as a new mom. So yeah. So and the doctors weren't mentioning anything else. The reason I ask is because when Robbie was 2, he stopped speaking. I took him to be evaluated at Summit Speech School, which was a school for hearing impaired kids, and it was early intervention. And they brought in people, you know, OTs, PTs, speech, all these different people. And they were also testing his fine motor skills, his gross motor, all these kind of things. And I asked them, I said, why are you looking for all these other things when I thought he had too many ear infections, and that's all this was. This was a hearing thing. And I didn't understand. I was young and naive and I didn't get it. And I didn't understand, why are you looking at all these other things when it's just a hearing problem? And they just simply said to me, well, we usually find that there's other things as well that come along with it. So I'm just wondering if anybody was saying anything like that to you, or if you thought this was the only issue you were dealing with.
We actually met a lot of our milestones early. He crawled early. He walked early. I can remember my son talking to me. It was tough. We could say, what sound does a cow make? And he'd look right at us and say, moo. We could say, touch your ear, touch your nose. He said, mama. He said, daddy. He'd go, uh-oh, all the time. And then it was about 18 months old, and he had a fever that lasted for 3 days. And I lost Brady after those 3 days. Brady went away.
I can't use the V word or YouTube will chop my video.
He just had a fever, and that's all.
That's it. It didn't follow any kind of immunizations or anything like that. It just kind of.
It did, but I don't believe that it was the primary cause. So we've seen a lot of geneticists. We've seen a lot of doctors. I do have a history in my family of people with anxiety disorder, bipolar disorder, a lot of emotional problems. And one doctor had said to me that all of that just trickles down through your family tree, and it just kind of explodes into one case. I don't know if it's true or not. I also don't know if it's medical procedures that cause that. I don't know if he was just born with that. All I know is for 3 days, he had a high fever of about 102, 103, kept taking him to the doctor, giving him the Tylenol, giving him the Advil. But after those 3 days, he didn't speak again. And so after that, at the 18-month mark, we immediately called the early childhood intervention team. Because I work in the school district, I had that number.
I was going to say, how did you know to do that? Because so you were already in the field.
District, and so No Child Left Behind. So I contacted them, and I was very lucky that I had an intake team come to my home within a week to have him evaluated, and we qualified for speech, OT, and nutritional, developmental, all those services in the home setting. And then we also continued with private speech therapy. So our feeding specialist then transferred to speech therapy. We also accessed OT. For a little bit of time, we did PT for a little while. And then we got on the wait list at the Meyer Center at Texas Children's Hospital to get a medical diagnosis, because we were suspecting autism at that time. Because
how old was he at this time? How old was he when he was evaluated?
He was diagnosed at 2 years, 3 months. I mean,
when the child study team evaluated him, how old was he? Like 18 months, 2 years old?
Yes. We only waited 1 week for them to come in. So he had the fever at 18 months old. He went downhill. I knew what was going on. I could just tell, because he started just staring at the ceiling fan. He would look at the hinges on a door as the door would open up, and he just opened and closed them all the time. He stopped making eye contact, and I was like, okay, I know what this is. Let's go ahead and get the help we need based on the symptoms that I'm seeing. and we'll get on the list for the Meyer Center to get this diagnosis if that's in fact what it was. And at the time, the wait was not that long, and he was diagnosed at 2 years, 3 months.
I was going to ask how long was the wait, because people are waiting.
Not long at all, but it's huge now. So I am on the Autism Family Guidance Committee at Texas Children's Hospital. So we work very closely with the nurses, the doctors, and also with the Meyer Center Clinic, which does a lot of the diagnosing of disorders and things like that. And there is a huge wait now, 7, 8, 9, 10, 11 months wait. We were very fortunate in that at that time, we didn't have to wait that long.
Let me ask you, since you're on the committee, why is it taking so long? Is it because there's so many more kids now that need to be seen? And how do we fix that? Are there not enough doctors in the field? I mean, because you're in Texas, you're telling me this, right? But I've had people in, Pennsylvania. There's the CHOP, Children's Hospital of Philadelphia, right? That are people waiting a year to get in there, and they're waiting 6 months to a year out here. So I'm just curious, because you're the first person I've talked to that's on a board. Like, what are you seeing?
Well, I have a few theories. I think one, people are becoming more aware of the symptoms of autism. And so they want to go ahead and get tested. Whereas in the past, I don't think that knowledge of, oh, this might be this and this might be that. So there is a little bit more of awareness of autism, and those parents want to get a diagnosis if their child is having it or not. I personally think that is really what it is. And also, I think another thing is parents are wanting a medical diagnosis at a hospital versus getting the educational eligibility diagnosis. Instead of going through the school system, they would rather go through a medical. I work with some phenomenal licensed specialists in school psychology that are more than capable of diagnosing and giving an eligibility of autism in the school system. But for me, I just wanted to hear it from a doctor, an MD. And I think a lot of parents want that as well.
Well, don't you need that though for insurance reasons? I mean, to pay for therapies and things, don't you need an official diagnosis from a doctor?
Yes, but you can take that school paperwork to your PCP, your primary care physician, and they can document that in the chart. You don't necessarily have to go through that whole entire process.
Oh, okay. Interesting. It's, the other day, somebody was complaining that they had to go to the emergency room for something, and it was so full of people, and they're like, why don't these people just go to their primary care physician for a lot of the stuff that they're there for? And it's insurance, it's whatever, I don't know. So it sounds kind of like the same thing. It's like they want to go to the hospital and get that diagnosis when they could just go to their pediatrician.
And it's not just autism at the Meyer Center. They're looking at other types of diagnosis and stuff like that. So you have a multitude of different types of families converging there to get evaluated. But the school system is backed up as well. So it's very difficult in both areas, educational and medical models, to get that assessment. There's just a lot of kids to be tested right now.
Yeah, you're seeing the increase out there in Texas too, I'm assuming. It's nationwide.
Oh gosh, yes, it's nationwide.
Yeah. In New Jersey, where I am, it's the highest. It's 1 in 32 kids out here.
Wow.
Yeah. But that's why I like to hear from people in other states to see what's going on out there, So, okay, so your son gets the official diagnosis, then what? Then did you put him in a school for autistic kids? Was he in public school?
So we stayed with early childhood intervention. And then at the age of 3, he qualified for school in the public school system for it's called PPCD here, Preschool Program for Children with Disabilities. And we immediately enrolled him right as his birthday was coming up, and we had to have an IEP meeting. And that was my first experience sitting on the other side of the table. So I work for the school district, and I had been working for them for probably 6, 7, 8 years-ish. It's all a blur sometimes. But then I'm sitting on the table, and I'm not the educational diagnostician running this IEP meeting. I am now the parent participating in this meeting. And it was very humbling. And I believe that having these experiences by sitting on the other side of the table has made me a better diagnostician, because I feel like I'm more empathetic with the parents. But it was rough. And I'll tell you that right now, Cindy, it was, everyone knows my story, so I'll share it with you. We were offered half day because that's just what preschool kids got. You get half day because everybody gets half day. This is the model. Everyone gets the same. That's not individualized. And so we had to go back and forth because they were saying that his least restrictive environment was being around kids that were typical. And I am a proponent of, it doesn't always have to be with general ed kids and typical peers and those that don't have disabilities. Sometimes it's better to be with someone that's trained to work with this particular type of disability, and they get it all day long. And we'll worry about the typical kids later, maybe integrating with them or mainstreaming with them at a later date. So I just kept trying to say his LRE, his least restrictive environment, is all day here. We have such a short window. We've got to push him as much as possible. If I'm going to do private after school and all these other things, he needs to stay all day long. I had to hire an attorney because I was not getting anywhere. No one was hearing me because he was the very first kid in the district that they had to consider full day for. And they're like, he's a 3-year-old. He's not going to be able to make it all day. Well, you don't know my son barely sleeps. He can make it for the whole day. Finally, the district gave us full day. He was the very first kid to get full day, which was a huge accomplishment, but it was very expensive for us. We had to pay our attorney $3,000 to do the IEP meeting. But he was able to do it, and we continued with public school all the way up until 4th grade. In 4th grade, we had to pull him out. The school district could no longer meet his needs. He became very aggressive.
Okay, was he in a contained classroom, or was he in a regular classroom with an aide? He was in a contained.
No, he was in a self-contained classroom for children with autism.
Okay, so it was only autistic kids in his class.
Only autistic kids.
Okay. And the teacher was trained, like someone specifically knew how to work with autistic kids.
Yes, yes. The thing is, as Brady got older, Brady became more aggressive. Brady has always been very prone to acid reflux. He's been very prone to strep. And all of these kind of factor into his aggression. We started, when we first got the diagnosis, doing everything holistic. We went gluten-free, we went dairy-free, we did all these supplements and stuff, and it just didn't seem to work for him. So then we went to see a psychiatrist, and we started on some medication, just different versions and things like that. But we noticed around 4th grade, he was so aggressive. He was eloping, he was self-abusing, he was hitting others.
How did he hurt himself? What was he doing? Biting, head banging?
Yes. So Brady's thing is he will gnaw on his arm until welts come up, till blood comes up. He's ripped some of his skin off with his teeth before. So we noticed that this was happening as like a flare-up kind of thing. But one time it was just so bad, my husband and I were like, we don't know what to do. So we took him to Texas Children's Hospital. And he was actually hospitalized in an inpatient type setting for these behaviors. They wanted us to go.
He was what? He was like 9, 10 years old?
Yes, it was so bad. So we're in the ER at Texas Children's Hospital. He's covered in blood. We're covered in blood. And they're like, okay, we don't quite know what we're going to do. Let us bring in the head of psychiatry. So she walks in, and it was like she had angel wings on.
Oh.
We have the best psychiatrist. We still see her to this day.
Oh, wow.
She came in, she's like, okay, this is what we need to do. We need to start him on this medication. We need to just reset his system. And at first they wanted us to go to like a mental hospital for youth. And I said, we can't send him. He's nonverbal. He's not potty trained. He won't be able to tell us if something has happened to him. Unless I can go and stay at that hospital with him, we can't do that. And we were actually able, me and the psychiatrist, my husband, we were able to work it to where we stayed on the 14th floor for about 5 days until he was able to reset with his meds and things like that. But from that, on our very last day, when things just started to seem a little bit better, one just rotating doctor that was just coming in to check on us, she goes, "Have y'all had a strep test yet?" I said, "No." She goes, "Let me do one really quick before y'all check out." She goes, she does the strep test. She comes back and everyone's covered up in this medical garb and stuff like that. And she goes, "Your son has strep." All of these behaviors that we had been seeing, this onset of behaviors was related to strep.
Yeah, because he didn't feel good and he couldn't tell you.
Exactly. And then we started noticing throughout the year and the next year and the next year, whenever he started biting his arm, we'd immediately just take him to urgent care.
Right.
They knew us by name. And I'm like, "We're here for a strep test." And they're like, "Are you sure?" "That's all. We know it's strep. We know it's strep. He's tearing up his left arm." He had strep. One year he had it 8 times.
Wow.
8 times. And I am so very fortunate in that I work, like I said, with some amazing people. And I work with a speech language pathologist who has a son with something called PANDAS. It's pediatric autoimmune neuropsychiatric disorders. It's associated with strep. So PANDAS. And she's like, "My son has
It's associated
PANDAS."
with strep?
Yes.
Huh.
Yes. And she goes, "He has these flare-ups. He'll get strep and OCD, tics, aggression, all self-abuse. It all happens when he gets strep." She goes, "That's something you might want to look into." And I'm thinking, well, we're constantly getting strep. And by that time, throughout the years, we had already had the tonsils removed and we were still getting strep. And so I thought, okay, let me go to a rheumatologist. And so we went to a rheumatologist, and this was about 3 years ago at Texas Children's Hospital. We found a rheumatologist that was knowledgeable about PANDAS because I wasn't. He's like, "Yes, it's a clinical diagnosis. There's not an actual lab test to do this. So we're going to set up some criteria. We'll watch him and we'll see if we do these things, does the strep continue? Does it not continue? Things like that." So the first one was, if he doesn't get strep within the next 3 months, we wouldn't consider it. Well, of course, he got it like 8 weeks later. If he doesn't get strep in the next 4 weeks, then we would do this, this, and this. So we monitored him for about 1.5 years before we got a formal diagnosis of PANDAS. And so now, because of that diagnosis, he's on 5 milliliters of penicillin in the morning and 5 milliliters in the afternoon. And he hasn't had strep since.
So he takes penicillin every day?
Yes, a low dose, 5 milliliters.
Really?
Yes. Now, are there going to be side effects long-term? Who knows?
Right.
Will he become immune to this penicillin? We have to switch to something else? Possibly. All I know is for like the last 3 years that we have been on this, my son has not had strep. Now, does he still have behaviors? Absolutely, but they're not associated with strep.
Right.
Brady also has irritable bowel disease, and we see a specialist for that. It's all in the gut.
Yeah.
It's all in the gut. He's had 2 or 3 colonoscopies within the last 2 years. Yes.
How do you do that?
Oh, sedate him.
Right. Yeah. But does he drink the stuff?
Yes.
Really?
He's so good about taking his medication. As long as I have a Pepsi, a Diet Pepsi to the side, he'll take his magnesium citrate. I've got 4 bottles ready to go if we ever need it.
Oh, wow. Yeah, no thanks.
I know, but they said it was a very quick procedure. And then I kept having nurses come out. She's like, his intestines are all kind of wonky and stuff. It was a 6-hour colonoscopy. That poor doctor, they had to switch out the nurses during the procedure. But, so I know that if he's in pain or if he self-abuses, it's going to be either the autism or it's going to be irritable bowel disease, things like that. And of course, we take medication for that as well. So he can be a very sickly child. but Texas Children's has always met our needs, and I love it. I told my husband we're never leaving Houston.
Right. Yeah. Yeah. Well, if you find people that you like, that's a huge thing.
Yes, but my son's about to turn 17, and then when he turns 18, I have been told that we'll have to find adult doctors, that the Children's Hospital may not see us anymore. I hope that's not true, because we love our psychiatrist and she's awesome, and we love our
She's only
rheumatologist.
pediatric.
Yes, he'll be an adult, and we might have to find somewhere else to go. And I just hate that. I try not to think about it, but I'm a proactive mom, so I can't help but think about that.
Do they have an autism center there?
Where?
At the hospital?
Oh, yes, they do.
Okay.
Yes, but again, for kids. So
it's not, they don't continue into adulthood?
well, I don't know. That's something I have to investigate. I was just,
you may have to do something about that.
I just found this all out. I just
You may
assumed
have
that
to,
30 years
step in
old, we
there.
still get to see our psychiatrist.
Yeah. Well, that's the thing. You may need to step in there and make some changes to make sure that it's an autism center all the way up into adulthood.
Yes.
So it'd be nice if you could see some of the same doctors stay within that, but I don't know.
But I squirrels so much, but we did pull him out of school when he was in 4th grade because they couldn't meet his needs. But of course we found out it was because of all the strep and stuff. But insurance agreed to pay for private school after we were in the hospital for 5 days. They're like, okay. And they caved after we had been fighting for so long, because we always wanted him in a private school that did ABA all day long. Right. So starting in 4th grade, we were able to get our insurance to pay for Brady to go to private school. So
insurance has to pay for that? I thought your Board of Ed has to pay for that.
No.
I mean, because that's, again, I don't know how it is out there, but
here, no, you're right.
District and that's when you get the attorney.
The parents have to fight for it. And I'm not going to.
Yeah. And that's when the attorney gets involved.
For it, especially when our insurance pays 100%.
Yeah. Okay. Well, there you go. See, I didn't know that was an option to have insurance pay.
Yes. So our insurance pays. We of course have a deductible, but I just didn't. It's not worth fighting the school district. The insurance is going to give.
Sure. Yeah. Yeah. If insurance pays,
and then I'm working for that school district too. It's tough.
Yeah.
So
that is you.
Yes.
Yeah, that's a conflict of interest right there. Yeah.
It's not supposed to be, but it does. It can be. But he went to that school all the way up until COVID closed it down.
Oh, wow.
And luckily we were able to find another place about 6 or 7 months after COVID shut that place down. We were able to go to another location, but for about 6 or 7 months he was home. And I was still required to work from home because I'm in education. So I had to hire respite care, but he just didn't understand. His schedule was messed up, and inevitably we were hospitalized again because he had a meltdown, a breakdown, whatever you want to call it, because for that whole time he was at that special school and it was awesome. And then now I'm stuck at home and I can't go out. I can't go to the grocery store like I love to go do. I can't walk around the mall. Yeah. He just didn't understand and he just melted. And so we were in the hospital for another 4 or 5 days. 14th floor again, Texas Children's Hospital. They let us stay. They were absolutely wonderful. And we just reset again with the meds. And knock on wood, we haven't had one of those hospitalizations.
What did he do for 5 days in the hospital? Just lay around in the bed? I mean, that was
He
always
did. He was exhausted. So of course they start with a heavy dose of different medications that he's already on, but they double or triple it. And then they slowly start to wean him off. And then we just kind of work on the different meds and levels and things like that. But he's always great in the hospital. I have to be honest with you. He's great in the hospital. He's great when we go to the grocery store, the mall. He's perfect when we go on trips. Perfect. Brady's favorite thing in the world is to go. It doesn't matter where you go. Let's just go. Mm-hmm. So at nighttime, my husband will take him just on rides on back roads back here because he just wants to listen to rap music and go. When we take our family trip every year, he loves to just go to whatever activity I plan, go to the hotel, go out to eat. He's awesome because it's just constant movement for him.
Yep.
And when COVID hit, of course, he couldn't do anything but stay here. It was tough for him.
You could go on rides in the car though, just can't get out.
Yes, but in
that
that very beginning stage, we were so afraid we were going to get pulled over by a cop because they were telling people to stay at home. So
I forgot about that. Yeah.
We were a little worried.
Yeah. Yeah. I'm actually very thankful that my son is in heaven now. He did not have to go through the COVID because it would have been really bad because he's the same. He just wants to be on the go always.
Yes.
And I was like,
there was a lot of kids at Texas Children's Hospital at the same time Brady was there going through the exact same thing. They had meltdown.
Wow.
It's just tough. And before we went to Texas Children's Hospital, my husband and I are like, I think it's time we have to put him in a facility. It's that bad because it was bad. And we went to one place here in Houston. They're like, okay, we're willing to meet with you. We go late at night to go meet with them. And they're like, oh, he's not potty trained. Oh, he's nonverbal. Oh, he's aggressive. Sorry, you can't go here. Go to this place. And I'm thinking, but this is what y'all do. And they're like, yes, but these people don't require one-on-one. It was tough. And that's why we just went back to Texas Children's Hospital. So I'll never make the mistake of going to these places for the other care. I'll just stick with Texas Children's.
Mm-hmm. Mm-hmm. So tell everybody what it is that you do for a living. You said you work for the schools, but you work with deaf children?
Yes. So I work for a regional day school program for the deaf, and my program services 11 different school districts, and my job is an educational diagnostician. So I evaluate students, I determine their strengths and their weaknesses, and I help the teacher set up goals and objectives and get the services that the child needs in order to be successful, because each child needs that specialized instruction. But I'm a fluent signer, so I work with the children that are deaf that need the sign language. But I've actually been working with a lot of nonverbal autistic kids that are deaf as well. God gave me a gift for that. So yeah. I'm helping for that as well.
Yeah. Well, it does help, because my son was nonverbal too. So they tried different ways of communicating, because that's the big issue. That's why you have the meltdowns, because they can't communicate. So if they could at least learn some signs, that helps them communicate. So I'm assuming you were trying to teach your son sign language from the very beginning, right?
Yes. But what has really helped Brady is it's a calendar box system. And when I was a teacher before I became an educational diagnostician, I worked with a child that was deaf and blind. And Texas School for the Blind and Visually Impaired came to my classroom to help me learn how to teach her better. And there's something called a calendar box system. And you can see that on the Texas School for the Blind and Visually Impaired's website. It's just a box with different things, and you can put 3D objects, you can put pictures, you can put written words, anything that you want to do. And you just talk about, first we're going to do this, then we're going to do this, and it's a wonderful language experience. And we're pointing, we're drawing about the different objects in the box. And we go to this, when we've done that, we put it in the finish box, and then we go to the next one. And then at the end of the day, you get your finish box. They're like, you remember when we did this earlier? You remember when we did that? And we have another language experience. So what has really helped Brady is this calendar box system. He knows what to expect. He actually gets to choose what goes in some of the boxes. And we started that at his school right now. So it's ABA with this calendar box system. And he's just flourished with it. And so we have noticed that his pointing, his gesturing, his use of the PEC system, all of that has increased since adding that calendar box system. I wouldn't have known about it though if I hadn't taught a child.
Right.
I think God has placed me in all these different situations because he gave Brady to me, saying, let me give you the tools to help raise him.
Right. Right. And then through that, you can help others.
Yes, that is exactly what I want to do. So right now, I have, of course, my bachelor's and my master's, but I'm a PhD candidate at Liberty University, and I chose educational law. My ultimate goal is to one day either retire or leave the public school sector and become a full-time educational advocate, special education advocate. They're calling them non-attorney advocates now. I would like to help parents because there's a lot of things that they don't know, that questions they don't even know what to ask. Their kids need help. They need help. And I want to be there to help, hold their hand and help them out and do those things. I have a heart for it.
Mm-hmm. Yeah, see, if I was you in that first IEP meeting and they told me he only needs a half day, I would have said, oh, okay, I guess you know best, like I wouldn't even have known, no, he really needs full day. He needs to have, therapy.
But I had a few years of special education already under my belt. So I knew, but I didn't know how to fight it.
Mm-hmm.
I didn't know how to prove my point besides throwing a tantrum or something like that. And that's why I had to go get an attorney. And there are a lot of parents that can't afford attorney, but they can maybe afford an advocate that can go with them and sit with them and like, okay, let's mediate. Let's figure out how we're going to do what we're going to do. Do you have any questions? Because a lot of times we go in there and it's rote. We're using acronyms after acronyms after, and the parents don't realize that.
Right.
What's going on? What do you mean? What are you saying? Oh, we only have a 45-minute timeline that you've given us to finish this ARD. And so this advocate can help bridge this gap that parents have with the school system.
Right, right. And somebody that understands the language and also kind of knows what their child needs. You can help guide the parents a little bit. Yeah. Yeah, that sounds great. So he's 16, he's living with you. He'll go to school till he's 21, I assume.
Your lips, God's ears. Hope so. A lot of times the insurance companies stop paying for private school after the child turns 18. So I'm hoping that our insurance company will continue to pay for it. That's why I went to school. If let's just say our insurance company doesn't pay for private school, I will have my degree and maybe I'll have to work with parents at nighttime while my husband is here at the house. And then during the day, I work with Brady here. We just have to kind of figure it out. But I knew I needed to get this done before he turned 18, just in case one has to work in the morning and one has to work at night.
Interesting. And then let's assume even that he can go to school till 18 or 21. What happens after that?
There's not many places around for kids that are this severe. Have you seen that in New Jersey too? It's just,
yes. Oh, yes. That's why I started my YouTube channel when my son had turned 21. There was nothing out there. There were no day programs. The day program he went to was actually started by 6 moms that all had autistic kids. And the principal of the school actually came to them and said, listen, there's nothing out there. And if you want something to happen, you have to do it yourself. And they started their own foundation and they did all themselves. It's one of my earlier interviews on my podcast. I talked to 2 of those moms. And we are, considered state of the art here in New Jersey, with all of the programs. People move here to New Jersey so they can get all these great programs, but it stops at 21.
Well, I mean, he could
what?
always go back to public school and he could stay till he's 21. If the insurance company were to stop paying for private, he could go back.
Right.
He would need to be reevaluated and placed back in the school system. I just really love what ABA has done for him, what ABA has done for us. But
you don't feel that ABA is abuse?
Ma'am?
Have you heard that? Have you heard that? Those arguments online? You don't feel that ABA is abuse?
No.
Have you heard that?
Absolutely. Well, yes.
That argument.
But I don't believe in that.
Right.
Yeah, I know if it works for my kid.
Right.
Positive reinforcements, replacement behaviors.
Yeah.
It's great for us. Honestly, I don't know where we would go because we are very limited. I have found 3 places. We're on the waiting list for one place, which luckily is only 10 minutes from my home. But again, insurance would have to pay for it.
And this is what, a group home or
it's a day facility.
A day, right. Okay. So it's someplace
so that he can still come home at night and be with us.
Okay. So you have to get on a waiting list for that.
Yeah, I've been on that one for a while. There's a place north of Houston, but it's like an hour drive.
Wow.
And that's pretty far. And then there's another one that's like a 45-minute drive. But again, the waiting lists are so long. They're so full. I really just, the world is unknown for the future. It really is. So right now, what I'm focusing on is when my son turns 17, we have found a company that's going to walk us through the stages of getting the guardianship, the stages of working to get the Social Security for him.
Yep.
I'm a proponent of, if you don't know it like the back of your hand, get someone that does know it like the back of their hand. So I'm going to get an advocate for us to walk us through the stages of guardianship and the SSI. And then hopefully if I learn it that well, I can help someone in the future. So that's our main focus right now, is getting ready for those two huge obstacles that are about to happen for us.
Right. So one of the last questions that I ask is, if you could talk to a governor, senator, somebody in your state, and they asked you, what do we need? If they said, we want to help families like you, what do you need? What would you tell them that you need?
A lot. Let me get my soapbox real quick. So we need more funding for special education programs.
Mm-hmm.
We need to be able to appeal to those that don't want to work in the public school system. We need more money for the teachers. The teachers need to get paid more. We need more people to help them out. We need more paraprofessionals. But also, when you're looking at that post-secondary model, we need more programs for families, for our severe kids to go to, whether it be day hab, whether it be residential, these little bitty pocket places that, oh, there's 4 in this state, there's 2 in this state. It's not enough. We need to be able to open more facilities for these children so that there's a place for them to go to. For those students that may not be able to hold down a job, may not be able to live on their own, they're severe like Brady. Where are they going to go? If the governor could put more money into that, that would be great. Paying more teachers, putting funding into the school system, and looking at those post-secondary needs for those students. That's what I would tell him.
Mm-hmm.
Or her.
Right. Yeah. Yeah, for sure. And that's you're on the same soapbox as I am, and it all comes down to money. It all comes down to funding.
Well, I'm on some other boards too, and I'm pushing. I keep saying we've got to start looking at the older population of students. Yes, that window of being, the child, the birth all the way up to 21. Yes, it's very important. There are those windows that you need to focus on, but those kids don't just magically go away, or the autism doesn't magically go away. We need to focus on that population as well. It's so very important. And I never really thought about that until my son got older, and I started to see, wow, the resources just started going down for kids at that early age, the late age.
Yeah. Yeah, I know. And I've been saying that for years. My son, he would be turning 31 now. So he's old compared to, he's way ahead of everybody else. And I kept saying all the little ones that are 5 or 10 even, and the autism keeps increasing. That's going to be like a tsunami that's going to hit, and yes. What are you going to do about it? What are you going to do? It's to me, that's the real pandemic. I mean, it's the amount of kids that have autism that are all going to turn 21 and become adults, and they need people to care for them. They need facilities to go to. And it's a big problem, and something needs to be done. So,
and will the money be there for them? Like Brady has been on a waiting list. It's called the HCS list. It's for him to be able to get money through the state to pay for therapies, to assisting group homes or job coaching or anything. The list is long, but he's been on that waiting list since he was 2 years old, and his name still hasn't come up. because it keeps getting frozen, or, well, yeah, it's been frozen like 2 or 3 times. And so we've had someone call us. He's like number 10,000 on the list, and he's 16. His name is never going to come up. Will they ever get the assistance that they need, even though we were proactive and got the name on the list when they were so young? So I just find it very frustrating.
Yeah. For me, for Robbie, his behaviors and the seizures and everything had gotten so bad that we finally went to the state for help, and they recommended that he go into a group home. He was number 4,555 on that list. And then I found out, no, there's another list. You have to be on the emergency list. Once you get on the emergency list, then that's when you get placement. It's when they're in danger of imminent peril, they're going to become homeless because the parents are going to pass away and they have nowhere to live and no relatives, like that's how you got them into,
But how did you find out about the list? Because I'm sure they weren't just like raising a banner up to tell everybody.
I met a woman that worked for a company that had group homes, because I'm in the interior design field. So she had come to me to help with a design thing for one of the homes. And I started talking to her, and I asked her, I said, how can I get my son into a place like this? And she told me. I said, he's on the priority list. She says, no, that's not good enough. No, there's beyond that is an emergency list. He has to get on that. And if I hadn't met her, I wouldn't have known. I mean, you talk about God setting things up. She just happened to walk into my work one day. So yeah.
We need more people to hold the hands of those that don't know. Like your one video where there's a woman that's just assisting families in helping them just go through the process of the whole autism journey. I watched one of your videos on that the other day. When Brady first got the diagnosis, I actually called a friend that had a son with autism. I'm like, I need you to be my mentor for 1 year. Can you promise me that you will be there for me for 365 days and just walk me through all the processes of food, of doctors, answer any questions I may have. I tell parents a lot of times when their child gets that diagnosis, find a buddy, someone that's already been through it, and be with that person for at least 1 year until you feel a little bit stronger about that process, because it worked for me.
Right. Well, yeah, I mean, and there's a couple of moms that I've interviewed that they actually have businesses that's what they do. Because they have older sons, and now they want to mentor and help the younger moms and help them get
and we
through the
need
process.
Yeah, because you're just like, you're inundated. Do I do the holistic? Do I do meds? Do I do ABA? Do I do public school? Do I do homeschool? It's so overwhelming. And then you have every book. I can remember having every autism book laid out. Okay, I need to do this. I need to do that. Oh God, where am I going to find the time? And I still have to work and pay the bills. And it's very overwhelming.
Yeah. It is. I
feel like we're ending this on a bad note. I just want you to know that there are good moments in all of these things. There really are. There is.
But sort of my purpose of doing these videos, the way it started was because somebody had told me that our governor wanted to do something to help autism families. And I said, he wants to do something? Like what? What does he want to know? Does he know anything about autism? Does he have any experience with it? Has he met with autism families? Has he talked to them and said, hey, what do you need? So I took it upon myself to start interviewing families and saying, hey, what are you going through and what do you need? That's why I ask the questions that I do. Because I'm trying to also find solutions. I had met someone that was running for governor, and he wanted to meet with all these parents of autistic kids. And we all told him, the issues, it's, whatever, it's a low income job. There's not enough training. There's not enough money, blah, 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 blah. And at the end he said, okay, so what's the solution? And nobody had an answer, so I'm trying to also pull that out of people, like, okay, how do we fix this? What's the answer? Maybe we can brainstorm together. I don't have it's all about the money.
It all comes down to that.
It's always about the money. And I've always said this, it's not going to happen until someone has an autistic child themselves, because then they'll care. They'll understand, and then they'll care. You care because you've lived it. Just like you said, when you sat in on that IEP meeting, right? Now, when you're in IEP meetings with other parents, you can relate to them. You understand because you've been through it, right? You've been on both sides of the table, So I don't know. We need governors that have autistic kids for something to get done. I don't know. I don't know. But from what I see, is moms are the ones that get it done. Just like you're going back to school, because you want to fix it. You want to do it. I've interviewed other moms that have started foundations. They've started their own day programs. They build their own group homes, because if you sit around waiting for other people to do it, it's not going to happen. So
Preach.
Yeah, right.
Say it
So
louder for the people on the back row.
yeah, exactly. Yeah. So, and that's the other thing. I want to kind of light a fire under moms and dads. I'm like, look, and inspire them. I want them to see what other parents are doing, and you can do it. You can. I didn't think I could do much, but I'm doing the best that I can. So just keep.
And I have to say, God bless my husband, because he's been riding around
Oh.
with both of my kids and 2 dogs
and keeping them quiet for a whole hour.
House. He's
Props
awesome.
to him.
Shout out to my husband, Guy.
That's awesome. All right. So, So terrific. Thank you very much for joining me and telling me your perspective, giving us your story. And I wish you all the best. And I hope, things get figured out for your son, that he can at least stay till he's 21 and things start getting put in place. So you can just pray for something to open up for him.
Thank you.
All right. Have a good night.
You too. Bye-bye.
Okay. Okay, that's it for part 1. Be sure to tune in for part 2. I hope you enjoyed listening and it helped you gain a new perspective. If you're interested in buying our book series, Robbie's World and His Spectrum of Adventures, the link will be in our episode description, as well as my Instagram and Facebook pages. If you enjoyed the show and you'd like more content, please be sure to hit that like button, follow us, and don't forget to leave us a great review. Thank you for joining us. Be sure to join us again on our next episode of Spectrum Perspectives.
Thank you for joining us for part 1 of today's episode. Be sure to join us again next time to hear the second half of the interview on Spectrum Perspectives.